Artificial Intelligence Doctor. User question. How do age-related changes in the autonomic nervous system affect cardiac regulation in patients with leadless pacemakers compared to those with traditional pacemakers? Claude AI answer. Age-related autonomic nervous system changes and pacemaker types. The autonomic nervous system undergoes significant changes with age, which substantially impact cardiac regulation and pacemaker function. Leadless pacemakers interact differently with these age-related changes compared to traditional transvenous pacemakers. As individuals age, several key changes occur in the autonomic nervous system. Decreased baroreceptor sensitivity reduces the body's ability to quickly respond to blood pressure changes. Reduced heart rate variability indicates decreased parasympathetic vagal tone. Increased sympathetic activity creates a baseline state of heightened sympathetic tone. Decreased neurotransmitter receptor sensitivity diminishes response to both sympathetic and parasympathetic signals. Autonomic denervation, progressive loss of autonomic nerve fibers to the heart. Traditional versus leadless pacemakers, interaction with autonomic changes. Lead-induced complications. Traditional leads can irritate cardiac tissue and adjacent nerves, potentially triggering inappropriate autonomic responses. Leadless, no lead-related mechanical interference with autonomic nerve fibers. Vagal nerve stimulation. Traditional, higher risk of inadvertent vagal stimulation, particularly problematic in elderly with already reduced vagal tone. Leadless, significantly reduced risk of vagal stimulation, preserving remaining parasympathetic function. Sympathetic activation. Traditional, lead placement and pocket formation can trigger sustained sympathetic activation, compounding age-related sympathetic dominance. Leadless, less surgical trauma results in reduced chronic sympathetic activation. Rate response algorithms. Traditional, accelerometer-based systems may not adequately compensate for age-related autonomic dysfunction. Leadless, advanced algorithms better adapted to detect subtle autonomic signals in elderly patients. Anatomical positioning. Traditional, RV apex placement often disrupts normal conduction patterns, exacerbating autonomic imbalance. Leadless, right ventricular septal positioning preserves more physiologic activation sequence. Clinical implications for elderly patients. Orthostatic hypotension management. Leadless pacemakers show improved blood pressure regulation during positional changes. Heart rate variability preservation. Better preservation of remaining heart rate variability with leadless systems. Circadian rhythm adaptation. Leadless pacemakers better accommodate age-related changes in circadian autonomic function. Exercise capacity. More physiologic response to exercise in leadless pacemaker recipients. Neurocardiogenic syncope susceptibility. Reduced incidence in leadless pacemaker patients. Conclusion. Leadless pacemakers offer distinct advantages for elderly patients with age-related autonomic nervous system changes. The absence of transvenous leads reduces mechanical interference with autonomic nerve fibers, while the intracardiac position minimizes inappropriate autonomic stimulation. These benefits may translate to more physiologic cardiac regulation, potentially improving symptoms related to autonomic dysfunction and enhancing quality of life in this vulnerable population.